Hi students, welcome to the next part in your infectious diseases. So in the first part we have discussed about the bacterial infections, your TB, syphilis, etc. And in this part I would like to discuss two important fungal infections that is being repeatedly asked in your NEET examination. So one fungal infection, what you learn is the Candida. Okay, Candidal infections are the most common or what fungal infections in the oral cavity. Okay, so what to talk about candidal infection is that in candidal infections in Candida, do you know that there is yeast form and hyphal form? Candida exists in yeast form and in its hyphal form. Okay, so in the oral cavity, it can exist as yeast or hyphal form. Right now, there are certain there is a different classification of fungal infections. It can be acute fungal infections or chronic fungal infections. Okay, so acute or chronic fungal infection, and based on the presentation, it can be acute atrophic or acute pseudomembranous. Pseudomembranous. Similarly, there is chronic atrophic and as chronic pseudomembranous. A pseudomembranous. So pseudomembranous, the chronic pseudomembranous form is the most commonly formed. Okay, we what we see the chronic pseudomembranous. Pseudomembranous is the most common form we see. Okay, and that is the oral thrush. Oral thrush. That is the oral thrush. And you know the features of this candidal infection. They appear as white scrapable lesions. White scrapable lesions. They will be scrapable in the oral cavity. Okay, you can scrape it with a mouth mirror or a swab. Okay, that is your pseudomembranous type. This is the most common one, or we call it oral thrush. Okay, and this is most commonly associated with your HIV infections, or whenever there is an immunocompromised condition, you get this what oral thrush. Right now, acute atrophic, or we say atrophic variant, mainly seen in the when you have so much of antibiotic sore mouth. Okay, if you are using more amount of antibiotics, the type of candidal infection which you get in the oral cavity is antibiotic sore mouth, so that is an atrophic variant. Okay, so this is a basic idea about your candidal infection. Now I would like to discuss a very important concept in candidal infection which they ask you. They ask you the concept between a mucor and aspergillosis. Okay, now how to these mucor and aspergillosis are two different fungal infections. You know, mucormycosis, that is very got very famous in the COVID time. Okay, that black fungus. Okay, that is your mucor fungus, that a rhinocerebral one which affect your nasal bridge, and it will affect to your eyeball. It is very dangerous fungus. Okay, so mucor and aspergillosis are two different fungus. Okay, two different what fungus, and how to identify, both are branching fungus. So you can see that how to identify mucor and aspergillus, that is a neat point of view. In the NEET examination they ask you, so you can see that you can trace this mucor fungus here, and you can see that the mucor is actually what aseptate. Okay, it is aseptate. Aseptate means it is not divided into septa, and you can see that the branches are at a 90-degree. The branches which is formed, can you see this image? The branching is at a 90-degree branch which is formed. So that is the peculiarity of mucor. It is aseptate and it is branch in 90 degrees. Okay, 90-degree. While in aspergillosis, what you can see is that, okay, can you see the aspergillosis? In the aspergillosis, if I magnify it, you can see that they are septated. You can see the differentiation. Okay, they are septated. Can you see? They are septated. Okay, and the branching is actually in an acute angle. Acute angle branching. The branches will form an acute angle with the main body. Okay, and they are septated. Okay, so septate acute angled fungus is your aspergillosis, and your aseptate right angle or aseptate obtuse angle is your mucor. Okay, so this is how we differentiate between a mucor and an aspergillosis. Okay, so nothing much they will ask you in this fungal, bacterial, and viral infections. Okay, you can have a read of your Schaefer, especially in your Neville. I prefer that you read the area of candidal infection because that is a good area. So the exercise, which portion of the textbook you have to read is just read the candida infection in the Neville or in the Schaefer. Okay, so thank you for the patient listening. See you in the next video.